In this section, we will learn about children with developmental disabilities, incidences of abuse, types of abuse, hidden potential disabilities, risk factors, behavioral indicators, disability symptoms mimicking signs of abuse, and other considerations. Some of our educators interact daily with children who have disabilities. Americans with Disabilities identifies a disability in an individual in part as a physical or mental impairment. This impairment substantially limits one or more major life activity of that individual. There will also be such a record of the impairment. A major life activity may include caring for oneself, performing manual tasks, seeing, hearing, eating, sleeping, walking, standing, lifting, bending, speaking, breathing, learning, reading, concentrating, thinking, communicating, and working. Major life activities also include the operation of major bodily functions, such as functions of the immune system, normal cell growth, digestive, bowel, bladder, neurological, brain, respiratory, circulatory, and reproductive functions. According to the Individuals with Disabilities Education Act amendments, a child with a disability is a child with mental retardation, hearing impairments including deafness, speech or language impairments, visual impairments including blindness, serious emotional disturbance, orthopedic impairments, autism, traumatic brain injury, or other health impairments or specific learning disabilities. Developmental delays can include physical development, cognitive development, communication development, social or emotional development, or adaptive development. Appropriate diagnostic instruments and procedures will be used to measure the developmental disability. Because they are more vulnerable and have greater needs, children with disabilities are at a higher risk for abuse. In 1993, children with disabilities were at 1.7 times more likely to be maltreated. In 2000, it increased to 3.4 times more likely to be maltreated. Studies have shown that those numbers have continued to increase. The most prevalent form of maltreatment is neglect. Studies have shown that children with disabilities are not only more likely to suffer maltreatment than their non-disabled peers, but that they suffer multiple incidents as well as multiple forms of maltreatment. Children with behavioral challenges may be at a higher risk for physical abuse because their caregivers may have an unrealistic expectation and become frustrated. Caregivers caring for children with behavioral disorders need to be educated on the child's needs and limitations before being left with the child. Education is key to ensuring that a child's special health care and educational needs are being met. Unfortunately, most perpetrators of child abuse or neglect are family members or trusted friends of the family. These children are exposed to more potentially abusive situations because of their exposure to multiple caregivers, both inside and outside the family. Educators should be alert for the existence of disabilities that have not been identified or diagnosed previously. This could be because they are not visible or because behavioral indicators have been overlooked for one reason or another. Most of the risk factors for abuse and neglect throughout this presentation apply to all children. However, children with disabilities have additional disability-related issues. The following are some of the additional risk factors. May be used to adults touching their body without their permission because of their need for physical assistance. May be less likely to recognize dangerous situations, which makes them less likely or able to take precautions. Can be exposed to multiple caregivers. Due to intellectual impairment, may be unable to distinguish between abusive and non-abusive acts. May be difficult to disclose abuse due to impaired communication. They are usually taught to be compliant. They are isolated and lack social support due to the negative view of society. They are rarely educated about abuse prevention. Oftentimes, abuse or neglect of children with disabilities is identified through observation of physical signs or verbal disclosure by the child. If a child is unable to tell you that they're being abused or neglected, behavior can be a good indicator. Even though some behavioral indicators are a result of the child's disability, a warning sign is any changes in those behaviors. Remember, some disability symptoms may be the result of abuse or neglect. We have covered physical and behavioral cues that may be symptomatic of abuse. However, some disabilities can create symptoms that mimic those of abuse or increase risk of accidental injury. Autism spectrum disorder, or ASD, is when the child may engage in repetitive behaviors that are self-injurious, which result in injuries that can be confused with symptoms of abuse. Cerebral palsy children suffer from an inability to control motor functions, which may impact their balance and cause involuntary movements. This can result in accidental injuries that can be confused with symptoms of abuse. Children with Prader-Willi syndrome may exhibit a number of concerning symptoms. These symptoms include having a high pain tolerance and unusual food-seeking behaviors. Also, these children may have additional learning, motor, and/or speech disabilities. Children with Tourette's syndrome may use foul language and words that can be sexually charged. Even though medication can help in decreasing their verbal explosions, many times their outbursts cannot be eradicated completely. Some medications may have an effect on a child's behavior. This behavior can vary throughout the day and continue to change. Other medical conditions can cause a child to bruise easily or be predisposed to fractures. Some conditions can result in physical findings that are typically associated with abuse. This is why it is important for teachers who work with children with disabilities to be aware of any changes in the child's behavior or body. Abuse or neglect of a child with disabilities will be ignored and allowed to continue if an injury or behavioral change is incorrectly attributed to the child's disability. The possibility of neglect or abuse should always be evaluated even if an injury can be attributed to the child's disability. Carefully evaluate your concerns and always err on the side of caution. Your concerns of abuse or neglect might be right on target. It is important to work as a team if you suspect any maltreatment. So ask your peers what they think about possible abuse or neglect. As a reminder, the interviewing of a child should be done by someone who is trained in forensic interviewing of a child, and any investigation should be done by the Child Protective Services Agency or law enforcement. Call to report any possible abuse or neglect to the appropriate agency. Do not forget to tell the agency if the use of an interpreter is needed. If the child with a disability uses an alternate method of communication, let the agency know what that alternate method is. Here's a few things to consider. Please become familiar with your facility's guidelines regarding child abuse reporting. Please know your point of contacts. Who receives a copy after you submit your report to the Child Protective Agency and the Fresno licensing facility? Also, I want to emphasize again that your responsibility is to report any suspected abuse or neglect. You should never investigate or interview a child you suspect of being abused or neglected. That is the responsibility of the appropriate agency.